the person has been at a certain moment of time or a period of time. What do? They normally start asking questions about normal things. Like, for example, how old are you? Where do you live? What's your name, first of all, in the beginning? Because it may happen that the person does have a false identity, and in that case, if the professionals know the truth, they can understand even about identity changes and the patterns that they use. Where do you live? What do you do in your free time? About family and usual things. So, those kind of questions are needed that the polygraph does have, let's say, to get to know the person about normal things which are true. Then the next step is a no question are asked. That means that the interrogator is going to ask questions that the person probably doesn't know, because the person does not know what kind of details or informations the police has, for example, or the agent who is asking the person has. Deviations from the truth, the supposed one, which in fact is the truth pattern, are assumed to indicate a lie. So, if we see any changes, going back to what we mentioned before, the way the person used to breathe when he or she was answering to common questions like where do you live, what's your name, about family, etc. So, if the respiration changes when we pass on to a known question, we understand, better to say the polygraph understand, and tells us by the graphical indications that, yes, come on. Okay, just to get you involved, we have been talking about lie and lie detectors. What are some of the signs and what polygraph is and how we can find out if a person is telling the truth or if a person is lying. And this is done by professionals and is done in important cases, for example, when a crime happens or when an information is misunderstood, because we want to find out if the person has sent the right message or has told a lie. So, two kind of questions that can be done by professionals who interrogate the person involved are normal questions, mainly about daily life and common things that everyone knows. And the second group of questions are unknown questions. We're going to see that if the four main factors, respiration, heart rate, blood pressure, and galvanic skin response changes on the second group, that is the unknown questions, it means that the person is telling a lie. It may be a lie, but be careful if it happens. Lie detectors can be fooled, which means I mentioned before the cases of agents and special agents, those who usually work undercover. You probably have seen lots of films like The Agent, 0017, 007. Do you remember Famous Agent? There are much more modern films which are connected with CIA agents and other institutions who look after international affairs with one country or with another country. Anyway, those people are different from common people, and when they have been involved into something that they were supposed not to do or not to abandon or tell a lie, they can fool the polygraph. So, lie detectors can be fooled in cases when, for common people, drugs can be used to dampen physiological reactivity. Internal or external stimuli can be used to alter every response, true or false. For example, the old back in the shoe trick, or through biofeedback training, an individual can learn to control the parameters being measured. Also, polygraphs have limited legal use. They cannot be used by employers in most situations, generally inadmissible as criminal evidence. So, one by one, what does it mean? There are some kinds of medicines that people take, and they do have an influence on our body and on the way we respond or react. There are some kinds of drugs that make us, for example, feel asleep. If you are under the flu and you take those Tylenol, for example, and similar ones, after some time you are going to feel like you want to sleep. There are other kinds of medicines or pills that do influence, and they are specific because they are taken on situations when someone thinks is going to have a lot of stress. There are some cases which I do not recommend. Students do take some of them before exams in America because they want to avoid stress, but they feel just like looking at you, feeling nothing, and they just write something down. If it is an oral exam, for example, this does have quite the opposite effect because you need to interact with people and you cannot be responsive. In this case, if a person has been under this kind of drugs, the second one, not the Tylenol one or another kind similar to that, it means that probably he or she is not going to have any respiration changes, so his or her breath is not going to change. The heart rate consequently is not going to change because he or she does not feel emotions. And on the next stage, he is not going to have a higher blood pressure. It doesn't matter what kind of question you ask to him or to her because it is not a situation that makes him or her have stress. So, as a result, in this case, the polygraph cannot find out if a person is lying or not. And that is the reason, going back to what we mentioned before, that we need to have professionals, not just by everyone. The second point, using internal or external stimuli by aiming to alter our response, they may lead us to an answer that we probably need to have. And when I say we, I refer to professionals, not just us included in this case. Because if one of the persons who is going to interrogate, let's say the one that they think is lying, may be suggestive. What does it mean? It means that we make these kinds of questions because our focus is on having one exact answer. For example, if they are focused on having the suggestion that the person has committed the crime, then the questions are going to be this kind that under the pressure, the person who is going to answer does